I want to officially welcome everyone to our August CAN meeting. We're officially a year old now, by the way, which is kind of exciting. I'm Ann Coffey, the CEO of CNPE and the coordinating host of CAN. I want to start off by thanking each of you for coming today. Your presence is helping us stay connected, deepening our understanding of what is happening in our community and learning together. CAN is a forum for nonprofit social impact leaders, volunteers, activists, funders, to hear about the most pressing issues and needs of our community. You'll hear from leaders across the region and experts from the field. It's a place to learn about substantive issues that impact our work and our community in deep ways. This is an open virtual space, and anyone who's interested in helping our nonprofit sector be more just and make greater impact is welcome and invited to join us. As a reminder, we will be recording the program portion of this session. The report out and discussion portion will not be recorded. And we ask that everyone stay on mute. So if you can check, just make sure you're on mute right now. That'd be really helpful. And as the program goes through, just put your comments and questions in the chat throughout your programming. We want this dynamic exchange of conversation going virtually. We kicked off the public safety series in January. These past 8 months, we've had city officials, the police chief, community leaders, and today, thought leaders from the Latinx community. And we welcome all three of you for being with us today and appreciate that. Next month, we will conclude this series by learning more about the public safety priorities of the Kentucky legislature. At the end of the series, we will develop a report of what we've learned and the themes that stood out, and we'll share that report broadly. And of course, it will always be available on our website. In the fall, in October, we will kick off a new theme called the flow of funding and generosity in our community. So I hope you'll keep coming back and joining us. Like past meetings, we will start with an opening conversation, then move to our candid breakout groups, where you will have an opportunity to connect and share with other members that have joined us today, and hopefully have a deeper discussion about the topic. We also want to encourage you to meet new people and make new connections. Our guest will be with us when you return and will participate in those candid discussions, and we will continue the open discussion. As you may know, CNPE is committed to ensuring that our programming reflects the diversity of organizations in our community and the people in them. To that end, we would like to make sure we are reaching voices from every corner of our nonprofit social impact sector, gaining insight from their wisdom and understanding their needs along the way. So in a minute, I will put up a quick poll to help us better understand that. So CNPE can better assess and understand our audiences and participants. This key data will help us develop a deeper understanding of the voices we are attracting, and maybe more importantly, voices we are not. Rest assured, this poll is anonymous, and any reporting using this data will be an aggregate and will only be used to help us understand who's here. We will not share any personal information. So I'm going to ask Merv to put up the poll. So Anthony Smith, who normally facilitates the conversations with our guest, could not be with us this morning. And I'm sorry to share with you that he's lost two very close family members as a result of COVID complications. And so he's taken some time to take care of himself and to be with his family. So we're sending Anthony our love and care as they go through this difficult time. And we certainly miss him this morning and are thinking of him. And we've asked Ed Cordes, our director, CNPE's director of consulting, and also a co-host of CAN, to step into that role. So now I'm going to turn this program over to you, Ed, so you can introduce our amazing guest and get us started.
Sure. Thank you, Ann, and welcome everyone. And especially welcome to our three amazing guests and presenters, sharers of wisdom and experience. With us this morning, we have Karina Barrias. She's a native of Guatemala. Through a Fulbright scholarship in 1996, Karina earned her BA with a minor in English, Psychology, and Education at U of L. She also received her master's in education with a concentration in counseling psychology from U of L. She started working with women's issues as president of the International Students Organization at U of L. She is one of the co-founders and currently works as the executive director for La Casita Center, a community of Latinx hospitality unique in the state of Kentucky that enhances the well-being of Louisville's Latinx community through education, empowerment, advocacy, and wellness. She was recently named by the Community Foundation one of the 13 Forces for Good. Perhaps you have seen her face on a billboard around town. And then very recently, within the last year, the Mexican government has presented Karina with an award that recognizes individuals for their invaluable work and assistance to the Mexican community living in Kentucky. So we welcome Karina. I'd like to introduce Professor Inatrucios Haynes. She joined the faculty at Brandeis School of Law in 1993. She is a nationally recognized scholar in immigration law, and she has been in the field for more than 30 years. Professor Trucios Haynes teaches constitutional law, immigration law, international law, and race in the law. And in those areas, she emphasizes issues affecting the Latinx community. Professor was the founder and director of the Brandeis School of Law Immigration Mini Clinic, a pilot project and the only live-in client clinical experience available to students at the time. Professor Trucios Haynes is the director of the Muhammad Ali Institute for Peace and Justice, a diversity unit within the Office of the Senior Associate Vice President for Diversity and Equity. She is the co-principal investigator for a 21st Century Research Innovation Grant, creating the Cooperative Consortium for Transdisciplinary Social Justice Research. She is the co-founder and co-director of the Brandeis Human Rights Advocacy Program, which she established in 2014, that focuses on immigration, non-citizen, and refugee rights. She was graduated from the Stanford Law School, where she served as associate editor of the Stanford Law Review, co-president of the Women of Stanford Law, and a member of the Stanford Latino Law Students Association. She serves on the Metro Louisville Ethics Commission by appointment. She has served as president of the board of the ACLU of Kentucky. She is also the co-president of the board of the Hispanic Latino Coalition of Louisville and a member of the board of directors of La Casita Center. And so, Professor Trucios Haynes, we welcome you. We also welcome Dr. Laura Escobar Ratliff. She is a clinical assistant professor at the Doctor of Social Work program at the University of Kentucky College of Social Work. I really butchered that. I'm sorry, but I think you all get the idea. She completed her DSW at St. Catherine University, University of St. Thomas School of Social Work in 2018. She has over 20 years of direct care, clinical, and administrative experience. Dr. Escobar Ratliff's community engagement and leadership include serving on La Casita Center's Board of Directors, Family Health Center's Board of Governors, and KYA Kids Count Community Advisory Committee. Dr. Escobar Ratliff's research interests include the Doctor of Social Work Program Development and Evaluation, scholarship of teaching and learning, Latinx issues, behavioral health services with a focus on equity and expansive practice, and leadership in the helping professions. And we welcome Dr. Escobar Ratliff this morning as well. Their bios are, Merv has put in the chat their bios, they're more complete bios. So if you would like to reference those. So welcome, and thank you again for joining us. The first question I'd like to pose to each of you, if you could take a minute or two, each of you take a minute or two, is from your perspective, what is public safety and what is your vision for it, both in general, but particularly within the context of the Latinx community. One of you would like to lead off.
I guess everybody's being shy this morning, so I'm gonna go and jump in. Buenos dias and good morning, everyone. This is a very important question, especially because public safety means something different to every community, especially if the community has been minoritized, marginalized, and has been put in the shadows. So public health, public health for everybody and safety, will mean, to be comfortable in your home, for you not to be scared. But for the Latinx community, for us is something very personal. It's something that we cannot hide from. We cannot hide from it in feeling unsafe in our homes, feeling unsafe when we are walking down the street, feeling unsafe when we go to work. So safety is something that is a luxury and a privilege that most of us do not, unfortunately, have. So one of the scary things for all of us, Black and brown mothers that have teenagers that have a Black and brown men in our lives, brothers, husbands, partners, is just to know if they are going to come home safely. The other part of it is that safety as well, is that you don't know if the people that you love, the people that you surround with, any member of your community, in one day, in 5 minutes, is going to be picked up or is going to be taken to immigration jail for no reason other than looking as a member of the white mainstream. So safety, it's something very personal. If we go to different levels, our children do not feel safe, not only because of their racism and discrimination out there, but also feeling this anguish. When I go home, am I gonna find my parents? When I go home, am I gonna be by myself? When are they gonna come and pick up my parents? When maybe I'm never gonna see my parents again. So it's something, very, very painful, very personal, and that is seen with a lens of not feeling safe most of the times.
I can follow on to what Karina spoke to about safety and how safety is really not felt by many in the Latinx community. A lot of our communities are living in isolated places and are in pockets around our city. So that isolation itself makes people less reluctant to seek out social services, to report crimes. There are many studies that have documented that Latinx communities, especially where there's a high level of immigration enforcement, which we do find in our state, are just reluctant to reach out to the police. There's less trust, reluctant to seek social services, and it has an immediate impact on health and safety for all members of the community. And to piggyback on something Karina just said, it affects documented and undocumented Latinx members of the Latinx community, as well as US citizens. We often don't think broadly of the Latinx community, but 75% of the Latinx community in the United States are US citizens. In Kentucky, it's 65% of Latinx members of the community are US citizens. However, all of us can be subject to a challenge about our foreignness, right? Are we really US citizens? And asked to show our papers. And it happens regularly with immigration enforcement. ICE vans will pull up, surround someone, jump out, and demand to see someone's papers. And they don't take no for an answer. And they will take someone into custody at a drop of a hat. And even throughout COVID, that has happened. And so safety is multidimensional, and really is the threat to safety is huge for within the Latinx community, particularly the undocumented community.
And I would echo what Karina and Enid have said in that multidimensional view of safety. So when I think of safety in general for any person, I'm thinking about your safety of your personhood, like Karina said, being able to go to your home without fear, being able to walk down the street, being able to go to work, but then the implications of that threat of safety to your personhood, to your willingness to seek services, whether it's for physical health or mental health reasons, or supportive services to get your basic needs met. All of that is encompassed under that need of public safety. And all of that is hindered when communities are marginalized. The Latinx community has a broad variety of representation of people, like Enid said, citizens, non-citizens, documented, undocumented, a variety of needs, a variety of historical trauma that comes with folks who immigrate to the country. I was born in the United States, but I'm very aware of the historical trauma my family has experienced, as well as my own trauma of being a citizen. And to Enid's comments about things still happening today with ICE, it happens with local law enforcement. I can remember not too many years ago that I was working in a rural community and there were traffic stops, not to check for drunken driving. It was in the middle of the afternoon and it was to check for documentation. It was to check every person to have a valid driver's license. And if you didn't, you better have papers or you were going to jail. And this was in the middle of a workday afternoon. There was no risk. There was no threat, quote unquote, to public safety. It was marginalization. It was oppression. It was abuse of power. And those things happen on a daily basis, whether you are documented, undocumented, a citizen, a resident, whatnot. You are very aware of your heritage, of your brownness, very much like our brothers and sisters in the African American community. You cannot know that you're not brown or that you're not Black. It is in the everyday interactions that somebody has with you, even more so with public health, with public safety officials. So to your question of what's our personal vision, my personal vision, I always start, and Karina and I joke, of the land of unicorns and rainbows. What's this, this magic wand, what can we get to? There's a lot that has to be done before we can even begin to scratch at that magic wand. But what I hope one day is that everybody, and in particular, those in power in public safety, in all of those multifaceted roles, understands the role of power, privilege, and oppression in what they do, and understands the multitude of implications for all marginalized groups. And that's a big ask, but if we want to get to a place where everybody's public safety is honored from who they are, then we have to be willing to do those things and have those difficult conversations.
And may I add a question to everybody that is with us this afternoon? May I ask if any of you accompanying us this morning, have you ever felt so scared that you have to carry with you something that proves that you are either a US citizen or that you have papers in this country? Does any of you carry, besides Edgardo, Inez, Laura, and myself, does any of you have to carry something besides your driver's license? Because your driver's license doesn't mean anything. Doesn't mean that you are a US citizen. Have you ever been scared that you are going to be asked if you are a citizen or not? So that's a question that I want to leave out there for you to share a little bit of the struggle that our community lives on a daily basis. Because the truth is that for the system, we all look undocumented, and we can tell you stories. All the Latinx people in this conversation, we can tell you stories of people that are US citizens, born and raised in the US, and they have been taken to immigration jail because they look undocumented to the system. And not that being undocumented is something wrong or bad, but that just our brownness, just like Dr. Escobar Rapki said, our brownness, we cannot hide it. We cannot escape from it. It comes with us.
Thank you so much for articulating these dire challenges, critical challenges that the Latinx community faces in our own community in the United States. Thank you. Thank you for the depth of your answers. And so I'm wondering, what initiatives, what initiatives have emerged within the Latinx community to meet these challenges? What do we need to know about what's going on within the community itself that is helping to meet these challenges? I think Dr. Escobar-Ratliff, very eloquently explained the big picture. This is what really has to happen for change to happen in our community and in our country. But I'm curious, what is emerging within the Latinx community itself? Professor Trucios Haynes, were you?
Sure. So I can speak to things that have happened in our community, such as the Welcoming City Ordinance that was passed by Metro Council several years ago to stop cooperation between police in Louisville and immigration enforcement officers. And ICE enforcement, immigration customs enforcement, is probably the biggest threat to the entire Latinx community, and that the possibility of being picked up and the presumption of foreignness that all of us wear on our bodies, and which we carry with us all the time. And so the Welcoming City Ordinance was a good first step by ensuring that there was no collaboration, but it was insufficient because the jail does have a cozy relationship with ICE, and ICE officers come in, and so someone who might not, if they are arrested, they will be put into immigration detention, and that prison to deportation pipeline is real, and it affects so many in our community. So we've done some things here, but more needs to be done. And I do think, many other states have offices of offices that address directly Latinx issues, and commissions that directly address from the state level and city level Latinx issues. And that's something that we need to see here in Kentucky and in Louisville. The Latinx community is growing rapidly. And in the 2010 census was 4.5% of the population of Kentucky, larger here in Louisville. So we are here and a substantial part of our system and part of the state. And I think, the lack of political representation can be a real issue. So some things have been done and much more needs to be done. And I think Karina can speak to, and Laura, to direct services kind of interventions that have happened more than I can. Yeah.
Thank you. Karina, Dr. Escobar-Ratliff.
So if I may, we are all facing a global pandemic. We have all seen the rise of mental health emergencies and crises, go up, domestic violence, sexual assault, trafficking. So, of course, there are systems in place that are accessible. You call it to a number, but what happens to our community is that the system in itself is not prepared and hasn't done its responsibility of providing meaningful access to services. So if I am going through domestic violence, if I am being victimized, and the law enforcement comes to my home, a lot of times, the children or the person that has hurt me is the one that is being asked to be an interpreter. So you can imagine, how unsafe that is. And not only with that, when a person is being taken to the hospital, is being taken to any a service provider, sometimes organizations don't see it as, okay, it's our duty, it's our responsibility, it's part of best practices to provide the best access. Is being seen like a burden. Oh, we have to ask for an interpreter. So that in itself, it is not safe. We also have seen, I really haven't really understanding, we are number one or number three in the nation with child abuse. You know, how are we going to address this if we have a system that in all honesty puts the whole family and the child in more danger because of language, because of culture, because of racism, because of prejudice? So the challenges are so great. And partly because, you know, it has been felt, you know, things have changed a little bit, I will say, in the last 21 years that I have started my professional life. You know, a little bit more inclusiveness, but usually we are an afterthought. We are invited to the tables for the picture. We are invited, but people don't want our voices, don't want our opinion, don't want our challenges, because, you know, what is this angry, threatening Latina? Who does she think she is with this crazy accent of hers? And I am just telling you verbatim, you know, my experience, or what has it been of not valuing, you know, the expertise. We are not being seen as the experts. We are not being seen as the professionals because the color of our skin, our accents precede us. And that is what gives us the value. And if that is, you know, for us that are in public service, can you imagine to people that honestly they want to be invisible? They don't want to be present because it is so scary. You know, you don't know. A lot of people prefer not to go to the doctor, prefer not to call the police, prefer not to go to school and just send their kids because the kid 5, 6, or 7 years old would understand it better than them, and because they are not being welcomed, and because we haven't done our work, our best practices on how to make really a community of inclusiveness.
And I want to amplify what Karina said in terms of who's at the table for these discussions. It is, you know, in service provision, Karina's absolutely right. There is this resistance, or resistance, I think is the right word, of, oh, we have to have a translator, and oh, we need to understand all these different multifaceted cultural implications, and oh, we assume that everybody from the Latinx population speaks Spanish, and we don't think about other languages, and oh, wait, there's indigenous languages, and what do we do with that? So there's this complexity in recognizing that the Latinx community is not one myopic community. It is very multifaceted and diverse within itself. And in order to really provide good public safety measures, we have to have those people at the table, and not just at the table as a checkbox. You know, anybody from a marginalized group will tell you, you've been invited to the table as a checkbox. Come sit with us, do the photo op. No, we need to have power and voice at the table. You know, the Black and Brown communities have done amazing work of organizing at a community level and pushing, but we have to push to get to the table. And we have to push when we're at the table for our voices to be validated and heard and incorporated. It shouldn't be that hard. If we truly care about public safety for all, it should be a welcoming environment, and an environment where everyone at the table, regardless of your background, is humble and hears what the other person has to say. But people come to the table with preconceived notions, inability to check their own humility, and this ownership of their power to make decisions without listening to others. And we have to get past that, or we're going to continue to repeat these cycles.
Thank you all very much. So you're sitting, you're not sitting, maybe you're sitting, but you're among, virtually at least, a collection of nonprofit leaders from across our community, across our nonprofit sector, funders, the leaders in the funder community. In what ways can this community, the nonprofit community, support these efforts, initiatives, needs that you all have just stated so well? what partnerships would be helpful? What sorts of advocacy, in particular from our nonprofit community, would be most helpful?
I would really encourage our nonprofit leaders to look at your table. Who is sitting with you? And I don't mean just your direct service providers. I'm talking about your managers, your senior leaders, your executive leaders. Who is at the table making decisions? And if it's not a diverse representation, you have a problem. We don't know what we don't know. And I can try to understand and learn as much as possible. But the reality is my experience as a Latinx woman is very different than Karina's, than Enid's. The three of us as Latinx women are very different than our African-American sisters, than our African-American brothers. You have to have a variety of people at the table with power to have voice and make change and build systems, because you cannot know for another community what is best unless you have that community at the table making those decisions.
And I will also add to what Dr. Escobar Radcliffe mentioned, is that invite, but make sure that the people that you are inviting so you can hear. But the problem as well is that, in white mainstream, everything is numbers, right? Everything is data and research. And we don't have time for that. Our people are dying. Our kids are still in cages. Families are still being separated at the border. Families are still being said, okay, good luck to you. We are letting you go of immigration jail and just sending them out to the world, and they staying in the streets. Families in our community that work so hard, that pay taxes, that have lifted us our industries like construction, yard work, horse industry, restaurants, that community that has contributed so much to us is invisible. Still, we haven't paid attention to them because we don't have the data, because we haven't done the research. So when organizations that serve immigrants and refugees, when Latinx leaders come to the table and we tell the stories, we are being looked at like, what are you talking about? The research in Florida doesn't say that. The research in California doesn't say that. But there is no research, right, that is in Louisville, and our voices are not being taken into account. It's like we have to prove that we are worthy to the attention and to be worthy to be at the table to change the way that safety is being said.
Thank you, Karina. Professor Trucios Haynes, did you want to weigh in on this?
Yes, and I so appreciate Laura and Karina speaking to having representation and voices at the table, because that is so important. And there are other things that nonprofits in particular can do as well. Language access, the idea of having documents translated rather, and having interpreters available readily is very important. And especially in Kentucky and Louisville, which we are a refugee resettlement community, there are lots of different languages spoken here. And language access is a civil right. So there's an obligation of any entity that receives federal funding to provide language access. And that means at a minimum at the front desk, right? So when people come in, but as Karina and Laura have spoken so eloquently about, it's about that outreach as well. And how do we make sure that our services we provide are truly welcoming and inclusive and address and provide a bridge to isolated communities. And often we're dealing with isolated communities. And I can say that one of the things that I did before the pandemic is I used to do Know Your Rights presentations at an immigration detention center in northern Kentucky, in Boone County. And I would see people every time I went, and we went monthly, and saw hundreds, always at least 75 up to 120, 150 people, and mostly men, but often women, and who had stories. Their primary worry was their families, who they had left behind. They didn't have funds to even make phone calls. They're being treated like criminals because they were in a jail, although their only violation may be that they are unlawfully present in the United States, and being unlawfully present is not a crime. And so, but treated like criminals. And knowing within a community, knowing that is a very realistic possibility just strikes fear and in the heart of all of us, really, because we all know people who've been taken into custody and deported at the end of the day, because our immigration system's broken. That's a whole separate conversation. But within Latinx communities, it is the importance is to have a varied voice, right? There are always those who are called to the table, and I think what we're talking about is bringing more people to the table to share those concerns, the reality of people's lives.
Thank you, Professor. Thank you all very much for. There's so much richness in all this. There's so much for all of us to think about. I'd like to actually give folks some time to chew on these ideas, trade ideas, and further reflect on what you all have said in our candid breakout group. So we'll do that in a moment. The purpose of these breakouts groups is to further consider, ask questions of one another about the information that we've just heard. To do that, perhaps you could reflect on these questions, and these were in the agenda that was sent you. What reflections do you have? What further questions do you have? What more would you like to know? How can our nonprofits in our community engage with the Latinx community, particularly in terms of public safety, but in general? Our presenters suggested a few. Can we think of some more? Can you think of some particularly in your own organization? And are you willing to share that? What action steps can the nonprofits take to be in solidarity with the Latinx community? Consider all of those as you gather, and remember, the sessions have two purposes. One is to consider these things, but others it's to make new connections and strengthen relationships, and to generate ideas with a bias toward action, because that's the key here. You heard our presenters talk about the importance of we don't have time. People are literally dying. We don't have time. So what can we do? How can we? What actions can we take? Merv has put some of the questions in the chat as well. So let's get in our groups. Merv, if you want to, we'll give you about 20 minutes or so, and then we'll come back, and our presenters will remain with us, and we can further the conversation. So Merv, take us away. See you on the other side.